Okay, well, it's 2 minutes past. Hopefully everyone is on their way or coming. So I just want to say thank you so much, first of all, for you all being here. This is our last webinar event of the year, and kind of slightly relieved at this point. It's been such a busy year of all the events and things we've put on. But yeah, it's also exciting. And I think this is a topic that is really of interest. I personally don't know much about it at all, so I'm really interested to learn more. So thank you so much to Georgia and Kate who've come along to join us today. I'll let them introduce themselves and I'll pass along to them now. So thank you.
Thanks so much, Jade, and thank you to all of you for having us here. We're very excited to be here to talk to you all about fair pay agreements. I'm Georgia, I'm a policy advisor in the fair pay agreement team at DHSC, and I'll hand over to Kate to quickly introduce herself.
Hi everyone. Yeah, as Georgia says, really nice to be here to meet you all today, and thanks so much to Jade for inviting us along. My name's Kate Shires. I'm a policy lead in the Department of Health and Social Care, working in the same team as Georgia on the Fair Pay Agreement.
We're just going to take you through a quick presentation on fair pay agreement, and then we've got time for questions at the end. I think if you want to just type questions in the chat, we'll go through them all at the end. So if we start with the slides, Kate, are you controlling them? Perfect, yeah. Thank you. So what is a fair pay agreement? It will set minimum pay and other terms and conditions for workers specifically in adult social care, and it will be agreed through sectoral collective bargaining. So we, DHSC, are going to set up an adult social care negotiating body that will bring together employers, workers, worker representatives, so trade unions and others, and they'll get together to negotiate a standardised set of pay and terms and conditions, as well as looking at other issues such as career progression, training. And then the final result will be the first ever fair pay agreement in the adult social care sector, and it will be law. So it will apply to all contracts automatically once it's laid in Parliament, and it will be the first agreement of its kind in adult social care. And we've been working collaboratively with employers, workers, local government and other parts of the sector to help us develop our policy thinking. And the Fair Pay Agreement is also going to be complemented by rights for trade unions to access workplaces in a responsible manner for recruitment and organising purposes in order to protect and advance the interests of workers in the workplace. So why are they being introduced? Also on the slides, have we moved slides on? On mine it's still on the first slide.
Oh, is it? Oh, sorry. On mine
no,
it's moving
no,
as long
as everyone else can see them.
It's not moving along.
Yeah, it's on the first slide still.
Have you done the slideshow from the beginning at the top? Because it's still sort of seeing all of the slides on the side.
Oh, sorry. On my screen, it's on the slide I wanted to be on. Right, let's try again. Oh, I'm going to stop sharing and reshare and see if that helps. Share screen. Right, resharing slides.
That's better. It's now open properly.
Perfect.
Thank you. Thanks.
Sorry about everybody.
So why are they being introduced? So there's over 1.5 million people working in adult social care who provide essential care and support every day to people with all ages and diverse needs, as a lot of you will know. It's a historically low paid sector, and most care workers are paid at or just above the national living wage. And the sector faces significant workforce challenges around keeping and recruiting staff. So we want to transform adult social care into a respected and rewarding career by backing career progression, focusing on learning and development, and recognising the complex skills and value that care workers do bring, so that working in care is seen as a profession and not just a job. And we also really want to address the recruitment and retention crisis in the sector to improve the quality of care that people receive, which will also help to reduce pressure on the NHS. So we're really hoping that the Fair Pay Agreement will recognise the workforce for their contribution and reward them for the important work they do, which will hopefully raise living standards for care workers across the country, which is one of the government's #1 priorities. Can you go to the next slide, please, Kate? Thank you. So when will it be introduced? We believe that a phased approach to implementing the FPA is essential to getting it right, so ensuring meaningful reform for the sector, whilst also complementing a wider programme of workforce reforms which are already going on. So these include changes to 0 hours contracts, statutory sick pay, and the national living wage, which are all expected to have impacts from 2026, 27 onwards. That's fairly soon. So in terms of our timelines, by this autumn, so around the next few months, we expect to achieve royal assent on the Employment Rights Bill, which is where the FPA legislation sits within. And then by next autumn, we aim to complete our public consultation and finalise the policy design, and then lay regulations in 2026 to establish the negotiating body that I talked about earlier. And we'd expect negotiations to then begin in 2027, with enough time to allow implementation for the first Fair Pay Agreement in 2028. And if we go to the next slide, I'll talk a bit about how it will be funded. So because most of adult social care is funded by the state through councils and the NHS, the government's going to financially contribute to the Fair Pay Agreement. So in the 2025 spending review, it allowed for an increase of over £4 billion of funding available for adult social care in 28-29 financial year compared to 25-26. So as part of this, £500 million was earmarked for improving pay terms and conditions, and other matters as part of the first Fair Pay Agreement. And this additional funding will be paid to councils to reflect the increased cost of care coming from the Fair Pay Agreement, which will represent the most significant improvement in investment in improving pay and conditions for adult social care staff to date. Also, to balance the need for greater pay for the social care workforce with the potential cost of taxpayers, we propose that the negotiating body will be given a cost envelope at the start of negotiations, which will set out the maximum funding available to councils to cover increased costs resulting from the Fair Pay Agreement. And then the body, so the adult social care negotiating body, will have to negotiate an outcome that's affordable within that envelope. And then am I handing over to you, Kate, for the next slides?
Yes, thank you. And thank you everybody again for bearing with us on the slides. I was just saying to Jade at the beginning, we're a Teams organisation in DHSC, so we always get slightly caught out on Zoom, but we'll learn, we'll do better next time. So I want to talk now about the public consultation. So we launched a public consultation on the 30th of September, and it's open until the 16th of January. So that is a chance for absolutely anybody with an interest in adult social care to share their views with us, respond to questions and comment on some of the proposals and ideas we've got about how all of this could work. That consultation is on the government's website. So it doesn't look at the outcome of a Fair Pay Agreement. So Georgia was talking about that this will cover new pay and terms and conditions. The consultation isn't asking what you think the new pay should be, whether you think it should be about pensions or sick pay or something else, but it's talking about the process for how we agree a Fair Pay Agreement. As I said, really interested to hear from lots of different people. On the slide there are some of the people in particular we're interested in hearing from. So people who work in adult social care, people who employ care workers, including all of you, adult social care providers, representative bodies, people who are providing unpaid care, people who are drawing on care and support, trade unions, and the wider parts of the system around commissioning, local government, councillors. So to get to where we are today, we've already been working with the sector to inform all of our policy ideas, and we've been doing this in a few different ways. Last year, we set up an adult social care, a Fair Pay Agreement working group, which is a senior steering group of the trade unions, some of the employer representatives and local government, and they've been coming together to agree some of the aspects of policy design at quite a high level. And then underneath that, we've had a series of task and finish groups, which have tended to be slightly deeper dives into specific parts of the policy, with some of the same people, but also with subject matter experts. And we've also been doing some slightly wider engagement through webinars to raise awareness. But we are really of the view that the only way to get this right is to talk to as many people as possible. So with the launch of our public consultation, it marks a bit of a change in our engagement programme, and we're trying to get out there slightly wider now to get as much input and views from you all in the wider sector as possible. And the consultation is one of the ways that we're going to do that. I'm going to talk a little bit about what's actually in the consultation. And I should say as well, we have published a consultation. We are very shortly going to be publishing an easy read version of that to make that more accessible. Ideally, it would have been published at the same time as the version that's already out there, so we are sorry about that, but an easy read version is going to be following very shortly. Because it's going to be published after the one that went out on the 30th of September, it will close a bit later, so it will still be open for the same amount of time, so everybody has the same opportunity to respond. And we've also published an impact assessment, which sets out our best understanding of some of the potential impacts, benefits and risks of the policy. So that might be something that people want to have a look at and consider alongside their consultation response. So this slide is giving you a little bit of an overview of what's actually in the consultation. It starts off with some introductory sections which talk about some of the things Georgia has just been through in terms of why we're doing this, the timelines and the funding. We then have a chapter on the negotiating body, and that talks about what this new adult social care negotiating body should look like, who should be involved, who could go along to represent workers, employers, local government and anybody else. We've got a chapter on the negotiating process that talks about how the negotiations could work, has some ideas about what kind of information government should give the negotiating body at the beginning to help them have their negotiations. And it also talks about the timelines of negotiations. So how long do we let the body negotiate for, and how much time do we leave for everybody to get ready to implement this? We have a chapter called Coverage and Remit, by which we mean who is covered by the Fair Pay Agreement, so which roles in the sector and what aspects of pay and terms and conditions should be in scope. So the Employment Rights Bill that underpins this sets out a really broad definition for who works in adult social care, and it basically says everybody who spends most of their time working in adult social care is covered by the Fair Pay Agreement. And we could leave it like that, or we could choose to, through the legislation next year, narrow that down. So that chapter is seeking views on that. We've got a section on dispute resolution, so that talks about what do we do if the two sides of the negotiations can't come to an agreement, what processes can we put in place to try and help them work through that. We have a section on implementation, which talks about how the Fair Pay Agreement is introduced to the sector, and what kinds of support and guidance government should give everybody to help get this right. And because, as Georgia mentioned, the Fair Pay Agreement will be put into law, and it will be enforceable like in the same way national minimum wage is. We've got a chapter talking about compliance and enforcement. So how do we help businesses, employers get this right, and how do we make sure that workers know what their new employment rights are and they know how to make sure they're getting access to them. And we've also got some closing sections where we have a bit of a glossary to try and simplify this and make it a bit more accessible. And we ask some questions about equalities and impact on particular parts of the workforce. In terms of what else we're doing to engage with the sector, as I mentioned, we've been doing some engagement so far, but we're really trying to extend that engagement programme in the period that the consultation is open for, to make sure that we're coming along to events like this and getting as many views as we possibly can to feed into our work. We've been running some DHSC events, we've been having roundtable discussions, teaching webinars to different groups, and we're hoping to get out on some visits. We've also been speaking at sector events, so using some of the contacts that we've made throughout our work so far, tagging along to things that are already existing and in the diary. So I guess that includes coming to things like this. And we're also looking at how best we can share information. So we'll shortly be putting out a video, which is a bit more of a visual summary of what we're trying to do. And we're looking at what kind of newsletters and blogs we can put out there to try and spread the word in different ways. We're trying to offer a mixture of inline and in-person events, trying to reach different parts of the sector, and we're still adding to that engagement programme every week. So if after this call you think, oh, I know somewhere they should go, they should talk to this person or that person, then please do get in touch and we'd be really happy to come along and talk to different groups. And I think this is my last slide. Why is the consultation response so important? We may have already touched on this, but essentially the consultation is everybody's chance to tell us whether how we think the policy should work is right, whether there are things that we need to improve, and as many voices as we get to respond to that consultation will help us really strengthen the policy. So having everybody's views will help us get this right and make sure the policy actually works on the ground. And ways that you can get involved, we'd really encourage everybody to engage with the consultation, read the document that's out there, respond to the survey, come along to events like this. We'd really welcome anybody being able to share information for us to help us spread the word, tell your members and other networks about the consultation, share the links via blog, social media, anything you've got that already exists. Do keep letting us know about events like this that you want us to come to, and we'd really welcome any feedback on the consultation itself and our engagement programme if you think there are things that we're missing. So we've popped our team email address on the slide there, and we can put it in the chat as well afterwards. So that's how you can get in touch with us if you've got any thoughts about other places that we should go or any other issues that we don't cover today. And I'm going to stop there. We've got plenty of time for questions. I can see loads of really great things that are already coming in through the chat, and we do really want to hear your views and understand what you think of this. We'll try and pick up as many questions as we can. So I'm going to pull the slides down so we can see each other, and then Jade, are you gonna organise us?
Yep, there's been a lot of questions, so I'm going to try and go through them. Sometimes people have made statements, so apologies if I've missed those, but I've tried to get everything. There's still questions coming in, so I'm just trying to grab those as well. So the first one is if funding is being provided to the local authorities or ICBs, if they're included, how long will this funding last? Is there a danger, once this funding runs out, of them then cutting care further down the line in order to pay for the increase? We're all for PAs being paid fairly, but trust in local authorities not so high. So just wondered if this had been considered.
Yeah, so I think, so essentially this is the funding that we've got for the first fair pay agreement is just that it's for the first fair pay agreement. And as I said earlier, there will be a cost envelope so that whatever's agreed will be affordable to councils. And yeah, hopefully in future years, there will be more fair pay agreements to come and the government will provide funding for that as well. As I say, it's like, yeah, for the future fair pay agreement. So yeah, this is just like the first step, I would say.
Okay, so there's been a lot of questions, as I suspected, about CHC and whether it applies to CHC or ICBs. Did you manage to get an answer on that?
Yes, and yeah, thanks so much, Jade, for flagging that was going to be a really big question for everybody. So I've asked a colleague who's slightly closer to CHC in the background as we've been talking, and colleagues have confirmed that yes, the Fair Pay Agreement will apply to CHC. So essentially, because CHC is covering care costs, we expect the Fair Pay Agreement to cover the cost, to increase the cost of care because it's increasing salaries. Then we would expect the ICBs to increase their fees when they're commissioning. There's probably more detail that will need to get worked through and that we'll pick up on our side. But the intention at this stage is that the ICBs, when they're commissioning care, need to be accounting for that rise and need to be factoring that in and passing it on. So hope that helps.
Thank you. And a question related to this is, are you consulting with the NHS, i.e. ICBs? The NHS traditionally has a poor view of care employees and the care sector, and in some area, individuals providing care via personal health budgets are being paid less than colleagues in adult social care.
Yeah, absolutely. I mean, the consultation's open to anyone, so anyone from any organisation can answer the consultation, and we really encourage you to share with colleagues anywhere. Well, the link should be in the slides. So, yeah, absolutely.
Sorry, let me cut you off. We've just had a question about acronyms. I do apologise, Sue. I try and say them all out loud and then forget. So CHC is continuing health budgets. That is when the NHS is providing the funding. ICBs are what used to be the CHC, yet another acronym. So ICB is Integrated Care Board, and they're the ones that have the money on behalf of the NHS and administer the personal health budgets for people. I think that was all the acronyms. So just ask if there's any I didn't cover. So it's just about whether you get your funding through the NHS or through a local authority. Otherwise, they're very similar. The budgets are often very similar, but it's just, yeah, who the money is coming from. Next question is, will the money given over be ring fenced? I assume this is to stop whether it's local authorities or ICBs taking the money and using it for other things.
That's a really good question. So the money is not going to be ring fenced, and it's part of the wider local government settlement, not specifically ring fenced.
Well, if you don't mind me, that's already quite a worry there with things being cut. I mean, members have seen budgets being cut across the board, particularly in the last couple of years, and scrutiny has increased. So, yeah, I think that is a worry straight there, that it needs to be ring fenced so it can only be used on PA pay. I know this isn't my consultation, but that's quite a danger. I just wanted to sort of say that.
Yeah, and I should say as well, where people have left statements, not everything has to be a question. If you just want to tell us what you think about something, we are going to take that away and factor it in. So really open to hearing reflections like that, Jade. That is still really helpful for us.
Brilliant, thank you. Somebody has asked, I know the Easy Read version isn't available yet, but when it is, where will they be able to find it, please?
It will be just on gov.uk where the consultation is, and we can absolutely share the link with you once it's published.
That would be great, and then I can add it to our website with this link, and then people could find it. Thank you.
Of course.
Will there be any possibility for local variation? Like, as in, I don't know, I don't quite yet. Like, will this just be, I don't know, picking a figure out of the air? All PAs have to be paid £13 an hour or whatever the amount is, because at the moment there's both variation in terms of like people live rurally and find it difficult to recruit, or if their needs are more complex and they have more medical issues. Whilst there isn't much room for manoeuvre at the moment, I just wondered how that kind of thing worked.
That's a good question. And part of the answer is that what we're trying to do is give the negotiating body itself as much freedom as it can to get together and decide that. So it might be that the negotiating body decides to do something that reflects, as you say, that not everywhere is being paid from the same point, but something at this stage we don't know the answer to. And I appreciate that any question that's answered with "we don't know the answer" is always a little bit frustrating. But yeah, I think down to the negotiating body. But that is a good point, and we've had a few really good conversations in the department sort of on about what this means for pay differentials and a number of related factors that the negotiating body will definitely need to consider. So something that we'll be thinking about.
Yeah, I suppose having a minimum threshold is a good start for then people to be able to raise when needed. But yeah, it would just be interesting. So one thing you mentioned, which a couple of people asked questions about actually, was about this phrase of someone working most of their time in the care sector. I can't remember the exact phrase. a lot of PAs only work a couple of hours, a few hours a week. Some people have multiple PAs doing a few hours, and those people are just as vital to that employer as someone working full time. So I think that raised some alarm bells in the chat to whether those kind of PAs would be covered. And also, when you have a small package, it can actually be harder to recruit. You know, say you get given 8 hours compared to full-time work, trying to find someone to just cover those is already hard. So I just wondered again whether those people would be covered.
So essentially who will be in scope of the final agreement will be down to who the negotiating body decides will be part of it. Who is in remit of who could be within that scope, if that makes sense, will be down to the legislation that we pass next year. So it's really essential to get these views across in your consultation responses, and it will help inform our policy thinking on it. So definitely really, really helpful to hear those views.
So that's the kind of thing that would be helpful to put in the consultation to respond to explain that kind of thing. Then yeah, okay.
Absolutely.
Yeah, definitely. It might be worth me adding as well. I think maybe what I said was confusing. So we don't mean that part-time workers are just automatically out of scope. I think what we probably mean, and we should make this clearer next time, is that we know that it's really hard to define what adult social care is, and there are some jobs in adult social care that might do, I wish I had an example and they've all gone out of my mind, but say for example someone that worked in housing services and it touches on adult social care, but the majority of their job is actually about housing. That kind of person isn't spending most of their time on adult social care, so we wouldn't consider them in scope. I don't think we mean if somebody is if somebody is a PA for 8 hours, they're automatically excluded. So yeah, thank you for flagging that question, because I think that was a confusing thing that I said.
Thank you. There was a question, there was one of the terms that brought up about access to the workplace, and someone asked, does that mean they will be able to request access to the disabled person's home?
They will not, no. Great question. So the new trade union measures coming in apply to organisations, and there's a minimum size that organisation needs to be and a minimum number of employees that organisation needs to have. I will double check the number, but it's something like if the organisation has more than 15 or 20 employees, it definitely isn't intended to apply to individuals, and the trade unions definitely don't have a right to come to anybody's individual home. So I hope that's helpful.
Lovely, thank you. So this next question, I'm just trying to, it says it does say money can't be a reason to deny care needs, but a PA, for example, who averages £30 an hour everywhere you look, I lost mine a year and a half ago, but I'm not allowed to pay more than the £15 per hour threshold. But I have been told, I think this is by her local council, they can do 22 at a push. So I think this is around local authorities already not responding to the reality of what rates are and the concern of how that will change under this. Probably not the easiest to answer.
Yeah, and thank you so much for sharing that. And I think it is a really good challenge and comes back to the point around commissioning, and that we as a department are having a few conversations with a team that works on commissioning around how some of the practices there need to change to reflect whatever happens with the fair pay agreement. There's a place in the consultation where we talk about how local authorities should be involved and what the role of commissioners, local authorities, but also commissioners, so I guess it also applies to the NHS and the integrated care boards. So if you've got views around that angle, I think that would also be really helpful for us to hear in the consultation, because we talked about the negotiations being between workers and employers, but we also know it's really important that the local councils and that any commissioners are involved, because they're the ones, as you say, controlling the fee rates. So we'd really welcome any feedback on that.
Thank you. The next question's an interesting one, is what will the makeup of the negotiating body be? Will there be people with lived experience of employing and using PA or care workers, or managing a budget for someone?
So that's one of the things that we are hoping to get some feedback on through the consultation. So we've put in there a proposal around what the negotiating body membership could look like. Because it's a consultation, nothing has been pre-decided, so that's very much there for people to tell us if they agree or disagree with. On the employer side, our proposal sets out that we do a bit of analysis to look at the size of the sector and the types of different settings and services, and then use that to work out how you divide up the seats. I think we have suggested that the Care Provider Alliance oversees that, but there would be representatives from different parts of the sector. We haven't yet worked out what the detail of that looks like. I think it's a really good point. I think that's exactly the kind of thing that we would like people to put in the consultation, and if everybody tells us that this is what we need to do, then that would really help us when we're coming together to decide what we should do. Because yeah, I think that's a really good point, and we really recognise that as I'm talking about people like the Care Provider Alliance, they don't cover PAs, and there are gaps in that, so we do need to think quite carefully about how we cover that. So would really welcome any really great suggestions through the consultation on that.
The next is more of a comment, but I think it relates to what we've just spoken about, which is the DHSC needs to think about how this will work for those receiving direct payments. It seems little thought has gone into this area. So I think there is such specific complexities, as we all know, around direct payments, no matter the funding body, just speaking generally here. And yeah, I do think it's really important to speak to PA employers who actually live this day in, day out, but also just the massive variation between councils that go on already. It's and ICBs. It's already a very difficult, sometimes you're competing 5 minutes down the road can pay sometimes massively more than you can in your area, and then sometimes you're competing with care agencies, and it's just constantly adding this battle within the already difficult care sector of competition. So yeah, I think it's just a comment, I suppose, that I've added on to. The next question is, how will PAs be represented in negotiations?
So the negotiating body, as Kate said, will be the makeup of the negotiating body is down to what comes out of the consultation, but PAs would be represented on via the employee representative, so trade unions. Is that right, Kate?
Yeah, so we're proposing that workers are represented through trade unions. We know that not everybody is in a union, and we know that there are some barriers to being in a union, including that it costs money. But even if you're not in a union, the outcome of the Fair Pay Agreement still applies to you. And there are different things going on that are trying to make union access slightly easier. But yeah, essentially, we expect unions to be the representatives, but also because we know not everyone's in a union, we're really open to hearing any other suggestions through the consultation.
So someone has just made a comment that PAs aren't in a union. I have just explained anyone can join a union, but I would bet if a percentage was taken of PAs across the board who are in a union, I bet uptake would be incredibly low, probably more so than any other sector, simply because it is such a weird role. You're working for an individual in a home. There is no connection between those people for anyone to say, oh, hey, join this, or this is helpful. So yeah, I think that might need to be thought about. I know, for example, you did a webinar yesterday for PAs specifically, but reaching PAs has historically been very difficult for anyone. I understand that. So yeah, it's an issue.
Yeah, it's a really good point, and exactly the kind of issues that we're here to think about. And it is difficult, as you say, because there is no body that represents wholly. So we'd really welcome any feedback and other ideas on how we plug some of these gaps.
So someone has put, will the terms and conditions put more on people who employ PAs? It's already a lot with pensions, national insurance, etc.
I suppose it comes down to what the negotiating body decides to do. And I completely appreciate the point that's been made. We should say as well, one of the things that will happen in the process is before an agreement is signed off by the government and put into the law, the government will have to make a bit of an assessment of what the impact of it would be. Is it actually affordable for everybody? What could some of the other risks be? So I'm going to write that down because that might, and at the minute we're thinking about what that process looks like. So perhaps that kind of impact on people is the kind of thing that we should be taking into consideration specifically, because I appreciate we're having some conversations and there's some things in our impact assessment around cost to businesses and what that looks like for like provider viability, for example. And I think this is not the same thing, but it's like in my mind a similar kind of thing that we need to feed into those conversations, and perhaps more so because it has such an impact on people's individual lives. So I know that wasn't an answer to the question, but it was I agree with your point, and we should definitely do some more thinking on that. And thank you for raising it.
Thank you. Has there been any consideration into different levels of pay for PAs working for packages of care funding by either the NHS or local authorities? Sometimes care funded individuals have got more complex needs. And then someone else wrote about saying potentially people should be paid for each complex need that they do, i.e. like a raise for the more complex cases they're looking after. So I guess it's just around, again, that variability depending on, people's needs.
Yeah, I guess that's a great question, a great point. Ultimately, what is decided by the body will be decided during negotiation. So they could decide to negotiate an agreement that does include those different things. But yeah, ultimately it will depend what they conclude during negotiations.
Right. Sorry. Will the fair pay agreement help to address the reality that a lot of care agencies historically overcharge and increase their fees annually and councils, employers of carers, and the care workers themselves don't actually receive a livable wage, which greatly impacts recruitment, retention, quality of care? Care agencies are often sacrificing quality of care for profit. So this is obviously specific to care agencies and how it will work with them.
I think this is exactly the kind of problem that we want the policy to address, and the intention is absolutely that we want to be able to make sure that this money is reaching care workers and improving living standards. It's a good point, and one we need to consider quite carefully around sacrificing quality. I think we're probably not blind to the fact that if we increase wages, some providers, some people, some agencies might be minded to decrease their staff or their quality. That's absolutely not what we want to come out of this. So we are going to be doing some thinking on how we can support the sector to comply with the fair pay agreement, how we can make sure we're not driving some of those impacts that we don't want to see around reducing quality. So work in progress, but have clocked the risk, and definitely something that we want to try to make sure that we address through this. And there is place in our consultation to talk a little bit around compliance and enforcement and implementation. So that's exactly the kind of feedback that will really help us get some of this right.
Thank you. Sorry, there's questions constantly coming in. I'm trying to copy and paste as quick as I can. So someone's asked about training. Health funded PAs have huge training requirements. If this is extended to adult social care, who will fund that? Now, I think that's usually down to either the council or Skills for Care at the moment. And will that change at all?
I think we would expect that if the negotiating body mandates whatever the negotiating body agrees in terms of pay, terms and conditions, and training should all be captured within the funding that comes from government. So when they're having the negotiations, I guess there are trade-offs they would need to make to think about that. For example, if the negotiating body decided, right, we want to do this training, then they would need to think about what that looks like, whether the costs can be captured in, as Georgia said, the 500 million for the first year. It could be more, it could be different every year after that. So they'd have to think about the trade-off between that and, I don't know, increasing pay by this much or that much, or doing like more pensions or something like that. But yeah, hoping they would all be captured within the funding envelope coming from government.
Thank you. Someone has commented that in Sheffield City Council, they use a PA rates tool where there are several multiple choice questions about the nature of support expected, which then gives a pay banding which represents the general market rate for that kind of support. So I thought I would just read that out. Someone else has commented, if the Care Act was actually upheld, when it comes to issues of sufficiency of the budget, this may not have actually been needed, which is very true, but unfortunately isn't happening, i.e. the Care Act is not being adhered to. So there's been a couple of questions about probationary periods. Now, I know this isn't directly related to the Fair Pay Agreement. I think there's a lot of fear around the fact that the new legislation coming through is putting probationary periods down to at least massively shortening them. I know it's not actually been confirmed yet, and that can be very worrying for PA employers who, again, are in just very different situations to other employers. And I know that's not directly related to this topic, but as there have been a couple of questions about that, I thought I'd just read it out and if you have any thoughts on it, but don't worry if you don't.
Yeah, thank you for sharing that. I know we definitely, even though it's not the immediate thing we work on, we have been working really closely with other teams in government who are in charge of all of these wider things that are going to be coming in. So we can definitely pass this on. We can ask the team that are doing this what engagement they've had with PAs and people who employ PAs, and we can pass that particular insight on and something to follow up on, because I can really appreciate how that's quite a different impact for anybody here compared to a big business, for example. I know that's not an answer, but that's a really useful insight, and we can definitely pass that on to relevant colleagues.
That would be great. If you do have a team you could put us in touch with to discuss this, because again, I know it's not related to now, but we had a webinar earlier in the year about some of the new changes coming, and I think a lot of the employers were scared to death, to be honest. There is such a difference between a company with an HR department and multiple levels versus you in your own home where you might be employing one or a very few amount of people. And yeah, so it would be absolutely great. I just, at the moment, there's no what's the word? Can't think of the phrase, but there's no leeway for PA employers, and I know it's very difficult to add that in, but I think it's a great worry for a lot of us. So yeah, that would be great. Thank you. The next one is, how do we keep up to date with developments on this? Is there a particular website that will give us details, and are there any further webinars that you might be holding sort of later down the line, please?
So if you just keep looking at the Gov UK website, that's where all the consultation bits will be. And once we publish a response to the consultation, it will be on there as well. But also, like, we're holding a range of webinars over the next few months. If anyone does want us to come and speak at another event or do some more engagement like this, we really, really appreciate it. So just email. I think, Jade, you've got our email. So if you just email us, we can arrange some more engagement events. For sure.
That would be great. Thank you. Another comment has been that I'm really concerned about unions and care agencies negotiating the training requirements of PAs when they know nothing about the job. A couple of people have agreed with that as well. It's I don't know if that's specific to training, what's required, or the Fair Pay Agreement, but in both cases I think there's not much contact between unions and employers and PAs, so there's just this disconnect if they're representing us that our voice is being lost in this, and the voice of PAs themselves.
Yeah, thank you for saying that, because I think we do recognise that PAs are, as we said before, a much harder group to reach than, say, some of the people who've got a big representative national body. We'll be really open to hearing suggestions, ideas about who should represent personal assistants in a negotiating body, and I think probably something that we need to do a little bit more thinking on too. Like, how do we find someone that does have the right expertise? What kind of person is that? What kind of process do we go through to find them? If that's something you've got particular ideas on, stick it in the consultation. But it's also completely valid to, like Rachel's comment there, it's also completely valid to put that in the consultation. I'm not saying that you need to know who the person should be, but that would be really helpful to hear. I'm going to answer Rachel's second point just because it is underneath and I'm talking, if that's all right, Jade. What unions would you plan to involve? So we've had 4 trade unions that we've been talking to so far that are on our working group. The reason that we've been engaging with those ones is because collectively combined they've got like the most membership in adult social care, recognising that that's not uniform across all the different roles and that unionisation in the sector is quite low. But the ones we've been talking to are Unison, GMB, Unite and the Royal College of Nursing. So in our consultation we've set out that we propose that those ones get together, form a group and they manage the worker representation. We're also proposing that other trade unions can talk to those guys, can apply to be involved, and there might be some criteria that we want to put in place about what that looks like. But definitely all still up on the table for debate. So if there are other ideas that we haven't thought of, other people that actually will be better placed or that we should do in addition, then that's something that we can definitely look at through the consultation. Because yeah, I know that's come across in a few comments and I can really appreciate why.
Yeah, I mean, I think groups like ours who, historically employers have fought for PA rights. Obviously, it goes hand in hand. If we can give good rights to our employees, then we're going to have better care. So, organisations like ourselves or DPOs or, I think are really important for individual employers to have that voice there and PAs through that. So I think that's one of the next questions as well, is about representation for individual employers in this whole thing. I think it's, and again, as I already said, it's such a unique sector, both no matter again the funding source, just to keep saying that, just so I'm not leaving anyone out, but yeah, it's if other people are speaking for us, then those complexities are going to be lost. So yeah, it's just really important to keep pushing that.
Yeah, no, that's a really good point. And one of the things that makes all of this policy so complex and why we're having to take quite a lot of time with it is because the sector is this gigantic beast made up of lots of different things. But if you all wrote in your consultation responses, hey, I think ILG community should represent PAs, then that feedback comes to government and is something that we would have to think about in the round. But the most important thing is that people respond to the consultation and tell us what they think, because that's not just a thing that we say so we've got something to say. What happens is our team sits down and reads every single response that people put into the consultation, and then we sort of will get all of that together to inform what the final approach is, which is why we bang on so much about the feedback.
Thank you. I just wanted to read out a comment from one of our committee members, which was, a number of us have direct experience of big care providers, and in our case the charity closed and no alternatives were found. That we have a limited voice at such big decisions is an enormous frustration, and personally the care system has failed my son, and his parents and the PAs have picked up the pieces. I think it's just representative of that sort of frustration that's out there, that we don't get listened to a lot of the time. I'm not, obviously you've been listening to us, great, I'm not saying it, but just in a wider level, it's a very difficult thing. there's also quite a few questions about training. We are actually holding a webinar on training next year just to answer those people. Skills for Care are going to be coming along. I know it doesn't solve the issues of finding good training that's being discussed in the chat, but yeah, it is something we know is a really difficult thing to access training, and they will be coming along to go through how it works and how best to find that training. I think, hang on, just another question come in. So there is a massive issue for regulation of PAs who are not NMC registered, I don't know that acronym, or under an agency who's regulated by the CQC. I'm not
sure what NMC stands for, but I understand the general point, that there is issues, and I've heard other people say in other conversations that I've been in, that there's a bit of a distinction between who is and isn't CQC.
Sorry. So Care Quality Commission, who sort of like regulate, I think they regulate things like GP surgeries or even social services, and the Nursing and Midwifery Council. So that, so if there's an issue with the PA, you've got some comeback without having to go through the courts. That would be, if I'm going to be, I have to pay for my care. So if I'm going to be paying quite a lot more, I want to have those protections and things in place.
Yeah, I mean, I understood the CQC part. It was more the NMC. So that's midwifery, National Midwifery Council, did you say?
Nursing and Midwifery Council. Yeah.
Oh, thank you.
Yeah.
I mean, no, I don't think any directly employed PAs are under the CQC, but they are looking at going through to local authorities to look at them. I will say that process so far has been very poor from my point of view, and again, the ones that I've read seem to be missing the issues. So I'm not sure that's a fix it in terms of currently. Hopefully they'll get better at doing it. But yeah, it is definitely a worry that there is no one looking out on councils on what's going on, really.
That's helpful, and thank you so much for explaining the National Nursing Midwifery Council. But yeah, I definitely take the point that PAs not regulated, which then makes things harder, and it will make it harder in all sorts of different ways, including to know whether the Fair Pay Agreement is being complied with. And we're having some conversations with teams in the department who work on commissioning and who work on the Care Quality Commission. So it's a useful point of feedback that we can feed into our discussions with them.
Thank you so much. So there's no more questions. So I think just the most important bit is, how do people respond to the consultation? I assume there's a link, and it would be great to have that, and I can put it on the website again and send it out to everyone, so everyone's got it to hand.
Yes, I am frantically just trying to find you the link now. Oh, here we are.
I've got it. I'll paste it into the chat now.
Thank you so much.
And as we said, there's an easy read that we haven't published yet. It's in the sort of very boring bureaucratic stages of clearance and getting published, and we will send Jade the link. I think it'll be on the same webpage, but we'll drop you an email, Jade, when that's published, and then you can share with everybody here and in whatever way is most appropriate.
Lovely, thank you so much, and thank you so much for today. And I know it's not easy answering questions on the fly. It's quite, I know how difficult it is, so thank you so much. And we would absolutely love to have you back next year when things have moved further along, and yeah, to hear some of the results. So but thank you so much for your time today, and thank you everyone for coming along. I know these things take energy and time out of our day, so it's really lovely to see you all. And for once, I don't have any events to plug or tell you to go and sign up for, as it's the last of the year. So yes, but thank you.
Oh, thank you so much for having us and for sharing all your views.
Thank you. And I'll send the chat to you as well, if that's okay, so you can see all the comments and things people have said. And yeah, it's a lot of bits and things in there that are important. So thank you.
Be great. Thanks so much for having us.
Thank you.
Thanks, everyone. Have a good day. Bye.
Bye-bye. Thank you.